Uh, so good morning to all. I just wanted to tell you about the project that we have done that is ICMR funded, and it started in 2024 and it has recently ended in 2026 now. The project is entitled Intergenerational Digital Health Literacy of Elderly by Adolescents, a Mutual Beneficence Model. Now, in this project, we wanted that both the generations should benefit from each other. So, we know that India is aging rapidly, and around 11% of the population that is by the elderly. So, and moreover, now the more emphasis in the health infrastructure that is on the digital era has come. And all the health facilities that are to be availed, they are online these days. And even our Reverend Prime Minister, Mr. Modi, he is also, emphasizing more on the digitalization. So here we felt that adolescents who are tech savvy, they can act as a bridge to reach the elderly who are not tech savvy. They feel a little left out, and they feel that they are not a part of the society, and they feel as if they are dependent on their the youngsters or on their kids. So we wanted to build a society where elderly also feel a part of the society, and they can use whatever is going on at present. So in this project, we our students, we chose from NSS. We visited different schools, and they adapted various families, and in all the families, elderly, they were first assessed. So we had to face little barriers also. Like elderly, they were not so forthcoming. They felt as if it's a fraud. I mean, whosoever is coming, they were not so, welcoming to the NSS students initially. So our students, they did a lot of effort, and they they build a rapport, and then they assess them. Now, in how our project is different from the other studies. Like in other studies, what we usually do is that somebody goes and they just assess like how much is the knowledge level, and what can be done. So it ends there. But we wanted to make it a little different, and we wanted to build something like intergenerational beneficence model, in which the students, they followed the elderly whom they taught up to 2 years. And our project, our approach is very flexible. It is not that the only students, they have to go to the elderly and teach them, even if they were little more comfortable with their family members. We told, okay, fine. So even the family members, they were taught, and then they were told to educate their parents regarding the digital health. So the main highlights of our project was that the elderly, they were taught about the various digital instruments, like the basic instruments, I'll say, how to manage with the smartphone, and how to operate a TV and a computer, and then BP apparatus, then glucometer, pulse oximeter. These things they were taught. Even, I was some of them, they didn't know how to use a digital thermometer also. So we just taught them everything. Now, elderly are not so sharp that they can just get it in one go, how to use them. So, our students, they, did a lot of efforts with them, because they used to say that in one visit, what all has been taught, it vanishes in the next visit. So, but with their consistent efforts, the elderly, they were taught. And in similar way, adolescents, they learned a lot, how to be patient. Today's Gen Z is not so patient, and they're always volatile and bubbling with energy and all that. So now they learn how to be, manage the problems, and, having a mental stability, etc. And the best part of our project was that, the rewarding, I'll say, which gave us boost was that many of them, they approached us in geriatric OPD also. In GMCH, Department of Community Medicine, we are running a geriatric OPD that is for the last 10 years. So many of them, they approached us from the mobile phones, and they shared, their investigations, which they could not do initially. So that was a booster for us, even though the number was less, but it told us, okay, yeah, our efforts are working somewhere. Other than that, we have recently opened an adult and elderly vaccination clinic also. So many of them, they asked about that also. So this is another awareness thing that is coming up, and it is really appreciable and commendable, because the vaccination of adults and elderly is not so common. We just emphasize more on the children, that the children should be vaccinated because their immunity is less. But with the age, immunity also wanes off. So they also need, the protection from the various diseases so that they can have a healthy life. And as life expectancy is increasing, so I think this is the need of the hour, and many elderly, they approached us for that also. And another thing that we have started is, geriatric bus, especially for catering to the health needs of the elderly. So this is the bus which is, supported by our institute and, monitored by our department. So any elderly in the whole Chandigarh, if he has any of the issues, so our team, they go and they help them out, and they just manage that health problem. If it has to be managed at home, so they manage there, or they just refer it to the nearest health facility. And the helpline number of that is 0172 266 9973. So it is appeal to everyone and those who are elderly that they should be avail the services which our department is offering. So especially in regards to the geriatric bus. And we have kept the bus as the healthy elderly on wheels. And another is the adult and the elderly vaccination clinic, which is really going in a good way. So anyone can just walk in and they can just get vaccinated, and that is at a very subsidized rate. It is not at increased price. And another is that we have a very dedicated geriatric OPD. So they can come, and this project, it really gave us boost, and now we want it should be scaled up in the neighboring states also. So recently we had done a workshop in which all the details of this project, they were shown, and many of the eminent speakers and the dignitaries from the surrounding medical colleges and surrounding states, like from Molana and then from Bathinda and then from Haryana, they were invited and they shared their experiences, and we wanted to scale up further. In fact, many the speakers, they came from the national level also, and they gave their online lectures and promoted this idea.